So the goal is to get you to the point where we're fasting for 48 hours. So if let's just imagine you were doing that now. You fast for 48 hours. You absolutely would have to be eating about 1,800, 1,900, maybe even 2,000 calories on those other 5 days. That would be vital, because if you fast for 48 hours and then still eat 1,400 calories because the medication's so powerful, then you're going to plateau really fast. That's the only caveat to long fasting, is you have to balance the long fast with a much higher intake on those other 5 days. You've lost 30 pounds, looking to lose 20, 25 more. So let me ask you, with the weight that you lost, looking at the last, you said 20 weeks or so, right? Has it slowed down? You lost more in the beginning and you're at a stall, or is it still smoothly and consistently losing?
I've actually, once I went to 10 milligrams, which I'm starting my 3rd month on that, I've consistently lost more weight. So the lower doses, I was averaging about 1 to 1.5 pounds per week. And since I started 10, I'm looking at my chart over here. I've averaged about 2 to 2.5 pounds per week.
Even as of this very last week. So no signs of the rate slowing down.
No.
Yeah. That's a good sign. That's a really good sign. And technically we don't need to do a reset, but we want to be proactive here. Do you happen to know roughly how many calories you think you average a day?
I don't. I'm probably around, I've been tracking, I'm going to say 13 is probably my highest. Some days I don't. I knew I make myself eat, but I don't. And I need to eat more calories. I do know that.
You do. You're basically a stone's throw away from, unless you're super lucky. There's always some people who can just starve themselves their entire weight loss goal. And they're like, what? This was so easy. And everybody else loses 15% of their weight and they're plateauing. So that you can only hope to be that lucky. So this is interesting. So then you're not in a plateau yet, but you are under eating. So remember the goal, we're going to talk about fasting next. So the goal is to get you to the point where we're fasting for 48 hours. So if let's just imagine you were doing that now. You fast for 48 hours. You absolutely would have to be eating about 1,800, 1,900, maybe even 2,000 calories on those other 5 days. That would be vital, because if you fast for 48 hours and then still eat 1,400 calories because the medication's so powerful, then you're going to plateau really fast. That's the only caveat to long fasting, is you have to balance the long fast with a much higher intake on those other 5 days. So we really want to, and this is for all you guys, we're zooming out of this sort of like, I'm losing weight every day concept to, with the FLOA protocol, the goal is to lose all your fat, all your weight for the week within that 2-day fasting window when you get there. And there's a lot of reasons for that. The fasting benefit itself is massive, and there's a ton of data to support that. But also we're trying to prevent you from plateauing. And depending on how many of my videos you've seen, the big trigger for a plateau is consistent caloric restriction over time. And so we're trying to adopt this sort of ancestral lifestyle where we balance feasting with fasting. And 1,800 calories really isn't a feast. It's supposed to be your daily requirements, but it might feel like a feast if you haven't been eating, or if you're on this med. That is a higher dose. So you said that the clinic you're working with, you guys had that discussion and they decided just to bump you up because you weren't losing fast enough?
Yeah, 5 was like non-existent for me. Like I had all my food noise came back. Like I'd maybe get 1 or 2 days of no food noise and appetite suppressant. 7.5 was okay, but 10 has been my sweet spot.
And I see that you're pre-diabetic too. So that actually makes a lot more sense. You are more insulin resistant. So you have that threshold being higher. It makes sense. Does it make sense, Melanie, that the concept is obviously the lowest dose that we can get away with, the better?
Yep.
Perfect. So that's important too. So if you're feeling really good with 10, let's just, you stay with that. And then how long have you been on the Samoralin? That's a really good peptide.
I have less than a week left. This will be my 4th week.
Cool. What did you notice when you started that, out of curiosity?
I haven't really noticed anything. I sleep really good. And before I was lucky to get 5 hours a night.
Yeah.
So I've been sleeping really good, but that's really all I've been noticing.
Samoralin increases growth hormone. So you'll get some of that fat mobilization that I like. AOD is more potent, but you get the other benefits of growth hormone, which is sleep and recovery and all that kind of stuff. So that's great, actually. And so with us, I see you're starting AOD, so you can swap over to AOD. That'll actually supercharge. And then, yeah, basically, I think for you, there's going to be no reset. Just make sure, though, as you increase your fasting, you simultaneously the windows, and we're going to talk about that next. As you start getting into the longer fasting, you just got to make sure you're increasing your caloric intake on the other days. Okay.
Okay.
Eventually getting yourself up to, we don't need to jump straight to 1800 from 1400, but maybe working over the next week or two, 1600, 1800. So we are going to do a little bit of a mini reset, but it's meshed with you actually continuing the program. So because we haven't down regulated, we're going to talk about all the categories next. Okay, cool. Michelle, AOD, fantastic. You haven't done any peptides or any GLP-1s, I see, correct, Michelle?
Not yet. I haven't had my call with the nurse yet.
Totally.
It's tomorrow.
All right. And do you happen to know how many calories you average? And no clue is an acceptable answer too.
Now it's probably 15 to 1800 in that range. I started tracking it when you said you don't track food, and then you said you're changing your mind because I've watched a lot of your videos. So I did my Fitness Pal and downloaded that. I had it one time before, but there is a free version, but if you pay for it, you can scan your food instead of having to type it. It's preference, but if you're going to want us to stay on it, I might bite the bullet and just.
Oh, no, you won't have to do it long term. So where I stand with calories, guys, just so you know, during the reset, you have to count calories. And if you're not doing a reset, if you've never counted, I do want 3 to 4 weeks of just that experience. And then you're good. Yeah, because it's a tedious process, and you really won't have to do it once because we're focusing on the hormones. And look, there's a lot of people out there that say it's all about calories, and then the other people say it's all about hormones. And the truth, they actually both matter. But what we're trying to say is the hormones influence significantly to a greater extent whether or not you're in that caloric deficit or surplus. So we just put our attention on optimizing hormones, but we still maintain some consciousness over calories, knowing a piece of pizza is freaking 400 calories or a tablespoon of peanut butter is this tiny little thing. Those are common areas.
So sad.
I know, but if you've never counted, you think, oh, you're
I'm like, it was at lunch and I was done like 1500. I'm like, oh my God.
No, it really does give you this sort of reality check. And then I call it consciousness in the future. Good. I would. And so now that you've been counting, do you feel like this amount that you're eating, that's normal for you? You've been doing that for a while?
I just started last week when I joined. So
no, I meant like now that you have a number. Yeah. Now that you have a number to associate with the amount, do you feel like this is how you've been eating?
Yeah, for sure. Except the ice cream at night. I guess that's no more.
You got
no more snacks and candies.
No, I think you're in the same boat. No reset needed. Calories probably need to go up a little bit as you start to get into the longer fasting, closer to that 1800 range. You guys have that TE calculator because you guys are activity levels. Stats are going to be a little bit differently. As you've heard me say, the TE calculators are always a little too high. If we can get somewhere to 80 to 85% of that number, that's like that ideal target of what you're eating every day. Outside
of Dr. Berg's, I'm sorry, is Dr. Berg's the one we should be going on? Because that's is there a better one to put in?
If you just, I have one on my welcome form, but if you just go to Google, if you go to Google, it's the first one that pops up. That one, that one's good.
Okay.
Cool. Okay. Jessica, we are dealing with Hashimoto's. LDN. Did you get a chance to look at the LDN? Are you familiar with that?
Yeah, I was prescribed it years ago, but I didn't quite understand. I was so disconnected from my body. And now that I'm just dealing with more as I age, I just turned 44. I'm invested in figuring this out because I am tired of having the flare-ups. I start and stop stuff way too often. And I think it's done more harm than good at this point. So from hearing what you're talking about, I probably need to reset.
Yeah, we're going to figure that out next for sure. So the LDN thing, it's in my books, pretty much everybody that has an autoimmune disease or an inflammatory condition should really consider LDN because it just gives you this extra boost in a whole nother category that would otherwise be a really big roadblock because high levels of inflammation is like different pathways, but it's synonymous with being very insulin resistant. And so it'll really be a roadblock. So talk to the provider about that on your call. You get the free management as part of the perk for this, and then you just pay for the prescription. And then if you want to continue LDN after you're done coaching with us, it's $40-50 a month. So it's pretty reasonable. LDN is not something, my same philosophy. It's not for life, but this is a really safe thing. It's about 10 times lower the dose than what its FDA indicated usage. So it's a really low dose, but for whatever reason, it just has a really powerful effect at modulating the immune system, which is what you want as your autoimmune. You calm down the immune system. It lowers the inflammation, exactly the things we want to support the weight loss. So definitely recommend you talk to a provider about that. And then I see, so you do have a history with GLP-1.
The only thing is, I don't know if to be honest, like I don't sleep well the first probably 2 nights. Like I did it at 2 and 2.5. I was fine, but then I noticed I was like, oh, I'm getting hungry. So then I upped it to 5. So I did 2.5 for 2 weeks, and then I upped it to 5. I do not sleep at night. I am like wired for 2 nights, and then I'm like out of commission for a day. So I don't know if it's the source I'm getting it from, which has been third party verified. I did all the work to make sure I went through it, or if I just shouldn't be taking it. And I don't know.
Yeah.
But to be honest, I've never lost more than like 10 pounds. I got down to 185. And I'm 5'8", so I'm still like,
yeah.
So I'm very frustrated.
No, for sure, for sure. First of all, I'm not sure who told you to go up, or the provider did, but that's a pretty fast. Usually 4 weeks is what you want to be on the first dose.
Okay.
So yeah, take your time with it. Even if you're not feeling it yet, I know it's just you want to give your body time to acclimate. Plus, we have so many other things that we're doing that we're throwing at your body that this is going to be very different, this experience. So take your time with it. When you start the 2.5, give it the full 4 weeks. If you still don't feel anything, obviously the 5 is the next level, but you're in communication with us. Let us know on the FLOA hotline, just so we can put that in your chart. But I think this time with the LDN as well, that's going to be a difference too as well. Yeah.
Well, because I noticed when I stopped taking the tirzepatide, my inflammation went nuts. Like I was so uncomfortable. And like the idea of not having to take tirzepatide forever is something I want. Do you think that LDN will be able to like take over with the inflammation, like to keep it down?
Yeah, LDN is very powerful. We're talking people with Lyme disease, like really magical stuff happens with LDN. And the fact that you'll be on both, that'll take care of your inflammation, right? And then I think we'll make these improvements in your metabolism. And then, yeah, I think with LDN still on hand, it's going to make it easier for us to get to that point where we can eventually wean you off the GLP-1. Say that I'm not in as much of a rush over the past 6 months as I've progressed and see more and more literature that comes out about these medications. Years ago, 2 years ago, year and a half ago, I was like, okay, great, let's use these, but let's get off as fast as possible. That's my holistic side. But then now I see more and more data that comes out. I still want us to be, relying on our body as much as possible, right? The least amount of dependence upon meds is always going to be the best for us. I don't care what med it is, and I don't care how safe you think it is. It's a medication. But I am more comfortable as more and more time passes that we don't have to rush that process, that we take our time, we give our body enough time to feel really good. We titrate slowly off. We test out the waters. Okay, a couple weeks without the med. How did I do? Oh my gosh, I'm gaining weight. Okay, go back on, low dose, test it out. Like we can play that game for a while. And for some people, if they need to do intermittent for the rest of their life, I'm trying to get people to not do that. Everyone's going to have their own journey, their own stress levels, their own background. And so we get them as close to that ideal as possible and see where they land. And that's going to be the goal for everybody here. Okay. So going back to whether we need to reset. So do you happen to know how many calories you think you average?
I'm probably averaging about 1,900 calories. I've been keeping track of like my protein. So I'm trying to get as much protein as I can, but it's really hard to get like more than 100 grams of protein.
Yeah.
So for me right now, but I'm looking at other sources than like meat. So
yeah, that's what you're going to have to do.
Yeah. So I'm doing like cottage cheese, egg, and meat so far. And then peas. So that's what I'm doing so far, but I just haven't been able to get over like 100 grams of protein yet.
definitely make that a focal point to keep working on increasing that. And protein powders, have you tried any supplements, any protein powders?
Some have been like good. They all have a weird, sicky, sweet taste to them. And I don't last too long with it. So no, I haven't found one that I feel like I could sustain or use daily or even weekly yet.
And more just the preference of the taste kind of thing.
Yeah.
Yeah. Keep playing that experiment, because it's going to be vitally important that you hit your protein goal. So you're going to want to keep taking the time to find one that you're good with. Honestly, I really don't care if it's whey is the most ideal, but you may be intolerant to whey. Do you know if you're good with whey protein?
I think I'm good with it. I haven't had any issues. I did a gut reset last year. I did a whole gut biome because I was having issues with that. But now I'm good. I take my supplements every day. I think I'd be okay with whey.
Good. That's definitely the ideal. And you can alternate that with vegetable proteins. Yeah. At that caloric intake, I think you're good. You don't need to reset. And we're going to get into the rest of the program here. So yeah, keep that up. That's a good intake.